Namaste and welcome to my channel. So we are going to start a series on breast, which is going to cover the aesthetic aspects of breast reconstruction. So we will discuss breast augmentation, mastopexy, reduction mammoplasty, etc. But before we start off with that, it is essential to know what are the landmarks in case of breast surgery and what are the landmark measurements that we should be aware of. So whenever we look at a case for breast reconstruction, whether it is aesthetic or not, we have to know about these terminologies because that is how the essential marking is done for the patient. Now to get an overview of this image, this is the sternal notch, these are the clavicles, and obviously this is the depiction of the breast. Now first of all, when you see a patient, when you mark them, some people prefer in standing, some people prefer the patient to be seated while doing the marking. So we should first mark the obvious. That is, in patients we first mark the midline of the chest. Then we mark what are known as the breast meridians. So these are nothing but imaginary lines which are passing from the mid-clavicular region across down to the breast. Now in an ideal scenario, they should pass through the NAC, but obviously in cases where there is mammary hypertrophy or there is some other deformity, they may not necessarily pass through the NAC, but it is a very important pre-op marking to highlight these breast meridians, to be able to also decide the symmetry on table and to ascertain the markings that we are doing, because once the patient is in lying down position, in supine position on the operation table, then it becomes difficult to assess. So now what are the standardized measurements that are given in books and that we should be aware of? Definitely, depending on the ethnicity, the race, the height, weight of the patient, the stature, there can be differences, but usually what we begin to learn with are the following markings. So first of all, then we obviously mark the nipple areolar region or the nipple areolar complex, the NAC. Then we all know that the IMF, that is the inframammary fold, is of utmost importance. Now obviously in a normal breast, this should be at the level of the NAC, and when the NAC goes lower down, then we start grading it according to the sagging seen in the breast, and that we will discuss when we discuss mastopexy or reduction mammoplasty. Just so that I can depict it right now, I have drawn it at this level. So this is the inframammary fold or the inframammary crease. Now initially all the measurements were taken only according to this fold, that is by how much we have to bring up the nipple areolar complex. All of this was served as a benchmark. Then it was realized that in a lot of patients even the IMF can start descending down, or it could be distorted, or in patients with very large breasts it may be difficult to depict it clearly. So sometimes passing a scale or passing a straight line below the breast and identifying the level of IMF can be done, which is the Elizabeth Hall Findlay method. Or what they have also described is that we should be aware of the footprint of the breast. So the footprint of the breast is very important because this is something which is known to be anatomically stable even if the patient develops sagging or has asymmetry. So on the chest, the level at which you start to see the breast begin and the base that it forms on the chest is the footprint of the breast. So now let's start with the measurements. So to begin with, first from the mid-clavicular line to the center of the NAC, usually it is depicted to be at a measurement of 19 to 21 centimeters. Similarly, this measurement of 19 to 21 centimeters has been described for an equilateral triangle. This equilateral triangle is situated at the sternal notch and drawn down to the levels of the NAC. So obviously in the ideal breast, this would be the measurements and they should form an equilateral triangle. Furthermore, what should be the size of the nipple areolar complex? So in most cases, the size of this NAC is between 4 to 5 centimeters, which we can use with a predetermined cookie cutter, which is an instrument that has a circumference of that measurement. So usually we keep it at 4 to 5 centimeters when we are reducing the size of the NAC. Other than that, from the NAC to the IMF, the distance below the breast to the IMF is considered to be around 5 to 6 or 5 to 7 centimeters. This is also an important measurement because when we use inferior pedicle or superior medial pedicle techniques, this helps us to decide the technique as well. Then another important measurement is this of the footprint of the breast. So usually this distance from the mid-clavicular region is at 8 centimeters. So this helps us to know that we are not overdoing it, not overdoing the lift. That is, we are avoiding high riding nipples as well, which can happen after surgery. So these measurements and landmarks are very important for us to understand before we begin the discussion of the aesthetic techniques for breast reconstruction.